Welcome back. And we're moving into our second conversation for today, joined by Dr. Javier Zuniga of the Central Health Region, talking about the mid-year health report and some of the things that we're seeing within this particular part of the country and what we can educate people on. So good morning, and thank you for being here.
Good morning, Marlene, and good morning to our audience as well.
Okay. So, Dr. Zuniga, the report that is produced by the Central Health Region kind of takes a look at the statistics as to what you're seeing in the hospitals and clinics and how we're doing. And I want to start off by asking you, what seems to be one of the greatest areas of concerns currently for the region?
Okay, so I will just give you a little brief history about the bulletin itself.
Yeah.
So the bulletin is a biannual bulletin, so we take out one at mid-year and one at end of the year.
Yeah.
And it's basically, as you said, to educate the people about the public health conditions and problems that we have facing the Belize district at that moment. And so it highlights some of the issues, major public health issues that affect the district. In this case, in this bulletin, in this issue, we're seeing that one of the issues we're facing at the moment, we continue to have NCDs as the as a public health issue. Yeah. The leading cause of deaths are caused by NCDs, or non-communicable diseases. We also have had issues with infant mortality that remains, the rate for infant mortality remains between 20 to 22 per 1,000 live births. We also see a little spike in the case of maternal mortality, and of course that is a public health issue that we need to deal with. A spike in dengue, as well.
Dengue.
And now that we have the rainy season now, we have to do other interventions to be able to prevent an increase in the number of cases. So those are some of the major issues that are affecting the Belize district on a whole at this moment.
So what we're seeing, and I want to start off looking at the top causes of death so far for the year. And as you mentioned, the first is cardiovascular issues, which are a part of the complications that can come from non-communicable diseases and other diseases as well. And then secondly, we have homicides, which are the murders that are taking place within this region, and also cancer. Let's jump into the issue of non-communicable diseases. And I know we speak so often about diabetes and hypertension and looking at your cholesterol, as people know them, or we say lipids test, and understanding what can be done from a public health perspective. I mean, you can't be in somebody's home telling them what to eat and what not to eat, or when to get out to exercise.
That's right.
But you keep on putting out the messages. Yes. So what can be done from a public health standpoint to get people to reduce their risk for these conditions?
Yeah. So when we speak about NCDs, we got to look at the risk factors.
Yeah.
And in the case of Belize population, our population, and this is the entire population, one of the major issues is diet, and the type of diet that we have, and it is more high carbohydrate diet. So that is one of the areas that we try to educate the people on lowering the carbohydrate intake, and this of course would reduce then obesity, and obesity is the mother of all risk factors. Yeah. Obesity then leads to other complications due to metabolic processes going wrong within the body, and then that then leads to diabetes and then hypertension. So these are the two leading causes of non-communicable diseases in our population. And of course, they're not only diseases, but they're risk factors then for cardiovascular diseases. Yeah. So it just makes sense, right? So high incidences of hypertension and diabetes then leads to deaths caused by cardiovascular diseases.
And some people have both.
That's right. Yeah. And the issue with cardiovascular diseases now is that it's not only the myocardial infarction, but it's the stroke as well that's included in that, hypertensive heart diseases, other heart complications,
Yeah.
you know. So it's not only, we're not only looking at myocardial infarction. So this is a list
heart
of,
attacks, yeah.
yeah, it's a list of diseases that we look at
Yeah.
in cardiovascular diseases.
Yeah.
And it all stems from non-communicable diseases.
Now, for the longest time, and I think we will continue to discuss it, it is a global issue when you talk about obesity or just being able to have people live a better lifestyle. You know, the public health issue is that obviously the more you come in contact with the healthcare system, the more you leave the productive sector. In other words, you can't go to work. There is a cost that comes to all of this, and that's where a lot of times the perspective from governments, aside from the fact of taking care of people, there is a greatest concern. And so, as I asked before, I think, how do you strategize to be able to help people make the type of behavior changes that you know are necessary in our society?
Yeah, and what we're looking at now in the Ministry of Health is we're trying to create wellness.
Okay.
Right, and so this is what we're preaching now. So what do we mean by wellness? Instead of having people come into the health facilities already ill,
Yeah.
we want people to come into the health facilities who are healthy,
Yeah.
so that they could do an annual checkup, a physical examination, laboratory examination, you know, and all these then lead to early detection of these chronic conditions. And once we can detect them early, then they can be controlled
Yeah.
early. But if people wait until they're complicated already,
Yeah.
you know, and we have a lot of people walking on the streets that already have diabetes and they have high blood pressure, but yet they feel well. But that doesn't mean that all is well within the body. So if they do not detect this at an early stage, then as time progresses, these diseases then lead to other complications within the body. And that's when they tend to appear at the health facilities.
Yeah.
And we want to prevent them from coming when they're already complicated.
And that's when they can have more severe complications.
That's right.
So it's getting a checkup.
That's right.
Once a year, twice a year?
We recommend once a year if everything is well.
Yeah.
Now, if it's chronic patients, then we have a schedule that we try to follow.
Okay.
And try to make appointments for these individuals so that they could come into the facility, do a checkup regularly. It could be monthly, it could be every 3 months. It depends on how the patient is at that time.
And you can get a checkup at the public health, at the public clinic.
That's right. And that's what we're saying. We're trying to create wellness.
Yeah.
And so we provide for these services. It's free of cost at the public health facilities. We could do the physical examination, we do the laboratory examination. If there are any other tests that needs to be done, we try to facilitate the patient.
Okay. So I want to get through as much as we can in our segment. So I want to talk about the communicable diseases, and it's interesting because we see the very same illnesses on the list most of the time, and that's respiratory illnesses, gastroenteritis, conjunctivitis, vaginal infections, and there's one more that I'm missing.
Candidiasis, which is a part of vaginal
Okay.
infection.
So we're talking about these are diseases obviously that you see very often. And I want to start with gastroenteritis because I also know there's a spike of what we call the stomach bug or bad stomach, whatever Belizeans call it. We see quite a bit of it happening right now. And a lot of this goes back to hygiene.
It all goes back to hygiene. The two major communicable disease, which is acute respiratory illnesses and gastroenteritis, all stems from practicing of good hygiene. The washing of hands, the washing of fruits, your veggies before you consume them or before you cook them, you know, the washing of the hands before and, well, after using the bathroom, before eating, you know, all these things are very important. The
Proper practices when coughing and sneezing.
So covering of the cough, we call it. So, you know, don't cough into your palms. So you cough in your elbow, in your sleeve, or
inside your
blouse or shirt.
Yeah.
So those are some of the practices that people don't tend to do.
Yeah.
And people sneeze or cough and open in the open, and that the air will carry those little particles which contain the virus, and then infect other people.
Yeah.
And that happens very quickly. That's why they're called communicable diseases.
Yeah.
So the basic hygiene measures are very important
Yeah.
to prevent these two diseases.
And when you talk respiratory illnesses, you're talking your flu, your cold.
It's
that can lead to bronchitis and pneumonia.
Right. 95% of the causes of both of these conditions, acute respiratory illness and gastroenteritis, is due to viral infections. 95%. There's only a few that are of other pathogens, primarily bacteria. But 95% are viral infections. They sometimes appear and disappear on their own.
Yeah.
In some other cases, they might need some medications just to decrease the symptoms like fever or pain associated with them. But other than that, usually they disappear on their own. Now, in the case of candidiasis and vaginitis, we have seen issues with these for the past couple years.
Yeah.
And it all stems from, of course, practicing good sexual behavior, or as we say, reproductive health as such. And we've been trying to have people or patients try to open up as to other conditions, because they might appear for a cold, but they might have other conditions that they have, and we need to also lower these statistics as well. So a little bit more needs to be done in terms of sexual health.
There is an education component, and you're right. You know, if you're talking your reproductive organs, people often, it's private. They won't necessarily go to the doctor and say I have a problem until it becomes uncontrollable.
That's right.
Now, if one has access to the public health clinic, is that also integrated as a part of the education they'll receive?
Of course. Health education is one of the basic components of primary health care.
Okay.
So the promotion and the prevention of diseases, and it all comes from health education. And so whenever people or patients would come into the facilities, health education starts from the point of contact, which would be the nurse that will see that patient first. So from then, that health education should start.
Okay. Now, we're also, since we spoke about respiratory illnesses, we're also providing, the Ministry of Health provides flu vaccines for vulnerable groups of persons.
That's right. That's one of the preventative measures that we also include.
Yeah.
So we do provide flu vaccines free of cost, and it is free for children up to 2 years. It is free for elderly patients above 65 years, or patients who have a chronic condition.
And pregnant mothers.
And pregnant mothers, of course.
Yeah.
So these are the population that we would provide this vaccine free of cost. Usually we'd recommend for it to be given at the end of the year, so that it prepares the patients for the coming year.
Yeah.
Right?
And the other populations can pay for a vaccine in private institutions as well, right?
Yeah, if we have too much in stock, we would provide flu vaccine. We do provide for all the health workers, free of cost as well. But if people would need that vaccine, and we have more than what we need, we would provide it as well.
Okay. All right, so we spoke about the need for proper hygiene practices, which is an essential reminder for people. We spoke about improving our lifestyles, increasing exercise, having a healthier diet. Let's talk about some of the things we're seeing when it comes to infant mortality and maternal mortality. Now, these are very important indicators for our country. And this year we've seen what is called a spike. We went from 1 last year to 4 this year of mothers dying during childbirth or in their pregnancy.
During pregnancy.
Yeah,
it could
during
be
pregnancy.
It could be at childbirth as well, and it could be after delivery. All that is included in maternal death.
Let's just try to understand this. Why is this an important indicator for our country?
As maternal mortality is an important indicator, and this is primarily because mothers are the ones that deliver healthy babies. So if the mother is healthy, more than likely they will deliver a healthy baby. Now, if we have too many children dying, then that is not ideal. It's not good for productivity. So one, of course, you don't have a healthy child. Two, that child does not go to school or remains with some type of mental psychiatric conditions that probably will not lead to good healthy development of the brain. They cannot learn, they cannot get a job, so the productivity of the country then drops and falls. The economy, so there is an increase in poverty as well, because people cannot get jobs. So that is why it's an important indicator. And maternal and infant mortality go hand in hand. Now, why we've had that increase in maternal mortality, it is primarily because we've seen that we have people who have unwanted pregnancies. So they tend not to be worried about the pregnancy. They tend not to seek medical attention. They wait until last minute or at time of birth to access healthcare. And then this leads then to complications with both the mother and the fetus. And it has led to, in our district, 4 deaths for this year, which is significant.
Yes,
it's not what we want.
because we're only halfway through the year too.
That's right. It's not what we would like. But as I said, it all stems from people not wanting that pregnancy.
Now, it is important for mothers, once they think they're pregnant, to go to the health to the clinic to check in.
Not only if they think, if they've missed a period.
So even before you have suspicion, if you're a little bit late, you go to the clinic.
And
why is this the new message coming out from?
The new message now is that even before you plan to get pregnant, visit the health facility. Earlier, yes. And this is because we want mothers to be healthy. So we want to, do that physical examination, make sure they're healthy before they even get pregnant. Take multivitamins before they get pregnant. All this leads to a healthy fetus, and of course then a healthy outcome of a delivery. So that is what we're now preaching. But if you plan to get pregnant, visit your health facility. If you've missed a period, visit your health facility.
And there are other practices that we see that oftentimes can lead to a more complicated pregnancy. One, for example, is improperly spacing children.
That's right. So mothers who tend to deliver every year, some don't even wait for an entire year, that is high risk. That's a high risk pregnancy, both for the mother and for the fetus. And not only the mother and fetus then, but then the other child that is not even 1 year old. What we try to bring across, the message we try to bring across is that mothers should deliver or have deliveries every 24 months to 60 months. So 2 years to 5 years more or less. And that would then give a higher chance of a healthy delivery as such.
And other reminders for mothers that they should take into consideration, mothers-to-be, that they should take into consideration?
When we look at the statistics for infant mortality and we go back to the deaths, we notice that these infant deaths are occurring in the early neonatal period, which is the first 7 days of life. And those neonatal deaths are due to 2 major causes. Prematurity, extreme prematurity, and congenital malformations. And the congenital malformations are more likely to be heart conditions as well. So we also see that it's not the high-risk groups that would be teenagers or women above 35 years. It's actually women in the optimum age for delivery. And again, it goes back to one, what are the risk factors that are affecting these mothers that lead to premature delivery? One of them, of course, is the unwanted pregnancy. So they don't seek medical attention. 2, the use of alcohol, the use of illegal drugs, smoking. all these are some of the risk factors, and as we see, it's not the high risk groups, it's the mothers who are at optimum age. So again, you know, if you're planning to be pregnant, if you know you're pregnant or you missed a period, please visit your nearest health facility. That is the message we're trying to bring across.
And the services that are offered at the clinic are free of cost?
It's all free of cost at the public health facilities.
Now talk about our vector-borne illnesses, and that is where we're seeing one of the biggest spikes. That's the increase in dengue cases in Central Health region. Now I know for the past couple of years, a lot of people have been focused on Zika and the implications that would come from that, but in the meantime, we have been continuously trying to battle the frequent incidences of dengue. Let's talk about what the Central Health region is doing to try to reduce the cases that we're seeing.
So in the terms of dengue, the Belize district on a whole is endemic, which means that it will always be present. And we will have cases or seasons when you have an increase. And that is normal. That's epidemiological. The epidemiology of the vector and the virus itself. Now, last year we were more concentrated with Zika, as you well said, and this was because it was new to our country. It was new to our region, so we were focused a lot on Zika, and that led
to... And people were concerned about the complications of microcephaly or the Guillain-Barré syndrome.
That's right. But that led to an increase in the activities that decreased then the mosquito that carry the virus. It's the same mosquito that carries dengue. So last year then you saw a decrease in dengue, and this was due to the increase of activities that we're doing for Zika. So when that phase of Zika passed, then we started again with our normal scheduling of spraying and the vector control interventions. But then now we see that dengue goes back up a little, but that is normal. But of course, when there's a high spike in dengue, that's when we become more concerned. More vector control activities are done within specific areas of the city, within specific areas of the district, the high-risk areas for the mosquito, for the vector itself, which is the Aedes aegypti mosquito. So that's when you see the truck goes out and starts spraying around, or we go, if we have a case, we always do an investigation, and then we do an intervention around the neighborhood.
So if you wonder why your another neighborhood is getting sprayed more than you do, it's probably because there was a case or cases detected.
That's right. And these are laboratory confirmed, because we also have suspected cases.
That's what I was going to say, because 46 for the first half of the year. Well, it's an increase from last year. I'm sure there's more, because not everybody visits the health care facilities when they're ill.
And there's more. We know there's more. And not everyone that comes in gets tested. We try to. It's difficult. Sometimes people leave and don't return, so they are lost. But those are the issues that we need to, that we face and we need to address as well.
We have not seen any dengue hemorrhagic fever.
Not for this year.
Which is the more life-threatening.
That's right.
Now, let's talk about Zika. Last year you saw 12 cases. So far for this year we've seen 7. I want to ask about the areas that have been identified where these cases were found and what has been done to mitigate them. As I mentioned earlier, it was more the complications of Zika that has people so worried.
What we've noticed with Zika is that for our district, it's mostly the urban areas. So Belize City, Kikaka, San Pedro. Those are the 3 areas that have had cases of Zika, and it continues for this year. It's the same areas that we see. And again, as soon as we detect one of these cases, or we suspect that patients have these conditions, we go into that community and do interventions. But again, Zika now becomes endemic, so it will always be here. Unfortunately, it leads to complications with infants, and leads to microcephaly. well, not everyone will have, not all the infants will
Yeah.
have a microcephaly, but we need to prevent one from occurring.
What's a tracking mechanism since it's so early into us seeing cases of Zika? What's a tracking mechanism involved with women or pregnant women who do get infected with Zika?
So once we suspect that they have Zika, they are followed very closely
Okay.
throughout the pregnancy. These mothers are contacted regularly. If they miss an appointment, we go out and find them, try to bring them back in, do the necessary interventions at that point of time in their pregnancy. And this is all to prevent then the child from having microcephaly.
Yeah.
And also, at the beginning, we don't want also other people to have Zika around the community.
Yeah.
So, those interventions are important at the point of contact or time when they're diagnosed with Zika as such.
Dr. Zuniga, have we had any child born with microcephaly that is possibly linked to Zika?
Yes, we've had a
Okay.
couple cases, and those children are being monitored very closely as well.
At birth or late stage? Because we also saw where some babies develop it 6 months later.
The cases that we've had, they've all been diagnosed at I wouldn't say at delivery, but when they come into the clinic for the checkup, so postnatal care, that's when we do all the measurements properly, and we have diagnosed some have been diagnosed at KHMH at time of delivery. So yes, we've had cases.
So it means that the messages that we had been hearing when there was more of a scare for Zika are still very important. If you're pregnant, you have to do what is necessary to prevent mosquito bites.
That's right.
All right. Or if you plan to get pregnant.
That's right. It all stems back to prevention.
Yeah.
And preventing the mosquito from biting, preventing the overpopulation of the mosquito.
Yeah.
So we target those areas where we have breeding areas of mosquito. So that is all important. We continue to try to have people clean up their yards, avoid having containers with water, because this is where the mosquito will lay its egg.
Yeah.
So those messages continue to be preached to the public.
All right. So what would you like to share with the public at this point about what we can do to ensure optimum health for ourselves and our family?
Again, as I said, what we're trying to do is to create wellness.
Yeah.
And even if you're not ill, a healthy individual, you should have a regular checkup, at least once a year. Now, if you're diagnosed with a medical condition, then that will entail more visits in the year. But again, the idea is to have people healthy.
Yeah.
And once you have healthy people, then you'll have a healthy and productive society and a healthy and productive country, better economy for the country.
Well, thank you for stopping in and going through the recent report with us, and we appreciate you sharing all this information.
Thank you as well for having me. And I just want to remind the public that we have a Facebook page for Central Health Region.
Yes.
So they could like the page and they will receive any updates. We regularly put health updates on the Facebook page. So please, if you want to.
Definitely a great way to access the people. So find Central Health Region on Facebook and follow them. You can see this very same report and obviously some of the prevention mechanisms that you've been promoting.
That's right.
So thank you for being here. We're going to go ahead and take a break, and when we come back, we'll be talking to a young man who is trying to raise some money for an outdoor community center. So stay tuned.